Hey everybody, Dr. Trey here, founder of The Trans Trainer, where I provide physical therapy, post-op programming, and fitness coaching to other queer and trans individuals. I've been getting some questions asked about how to grow your chest better, especially when we're talking pre or post-op top surgery, from folks who are already doing a lot of chest strengthening exercises, whether that be bench press, push-ups, chest press with dumbbells, chest flies on the cables, and they're saying they're just not seeing the results that they want. So what I want to do is talk a couple things about form and how we can turn our pec muscles on during these exercises as opposed to our anterior delt, which I see a lot of people using instead. So we're going to talk about 3 key tips that we can do during these exercises to really get your chest on fire. So number 1, you have to set your shoulder blades down and back, and at the same time stick your chest out. So I know that's hard for us, especially when we spent years hiding our chest and rounding our shoulders forward. If we want to grow our chest in our pec muscles, we have to set our shoulder blades back and get our chest forward. This puts us in the right position to start the exercise. Number 2 is when we're picking our exercises, we need to think about the anatomy. And what I mean by that is we are trying to grow our pec major and minor. Our main chest muscles, our pecs, attach from our arm bone onto our sternum, okay? So when we try to contract a muscle, when the muscle fibers shorten, the way to do that would be to bring the 2 ends of the muscle together. Now, when we're doing a press with dumbbells or when we're doing a press with the cables or flies, that action mimics how that muscle contracts, meaning my arm is coming across my body to get a better squeeze, right? The exercises that don't do that as well would be when our arm is going straight in and out. So for example, a bench press and a push-ups. It's not to say that those are bad exercises. They just target a little bit more all upper body strength as opposed to purely your pecs. So if you're really trying to target your pec muscles, think about exercises that bring your arm across your body to get that squeeze as opposed to straight out in front of you, okay? And the third one is, again, thinking about getting that full squeeze. And the way to do that is to get our shoulders into a little bit of external rotation, or what I like to think about is leading with my pinkies. So when I'm doing, for example, a chest fly, instead of bringing my thumbs together and rounding my shoulders in and we can see my delt pop in, instead think about leading with the pinkies. And now as I'm coming together, we can see my chest is going to be activated. So in recap, the 3 things I want you all to think about if you're really trying to grow your chest: setting your shoulder blades down and back while simultaneously sticking your chest out. Number 2, pick exercises that work the anatomy of the pec muscle, where your arm comes across your body to shorten those fibers. And number 3, get those arms in a little bit of external rotation, or think about bringing your pinkies together. All right, y'all, happy strengthening, and let me know if you have any other questions or concerns on how I can better help your recovery and your strength as a fellow trans man. All right, thank you.